Maggie has battled severe treatment-resistant depression her whole life. At the age of 52, her condition dangerously deteriorated, and having run out of options, Maggie's psychiatrist referred her to Dr. David Feifel at UCSD's Center for Advanced Treatments of Mood and Anxiety Disorders. Since then, Maggie makes the 2-hour journey each way from her home to receive treatments from Dr. Feifel.
I've always just kind of wanted to not be here. You know, I think I just feel like if I could quietly somehow just slip away, that's really all I've ever really wanted. It felt to me like I wore this steel armor my whole life. It wasn't penetrable, nothing could penetrate into that. I had this awkward weight that I carried around with me everywhere I went. For most of my life, I was able to keep that under wraps. You know, I kept my depression very separate from my normal life, and I was the life of the party. I think I put on this really good air of good, and I was silly and crazy, and just, nobody really knew. When you have treatment-resistant depression, any kind of depression for long periods of time, you get into a place where you are hopeless. Nothing will work. You feel really insignificant to a point where life and living it is really difficult. Depression steals from you everything that makes you a good person. It takes away from you. It robs you of your self-worth and your significance, and it leaves you dark and lonely, and it makes you, if you feel abandoned. I went into the hospital the first time when my daughter, I think, was 18 months old. I've been inpatient 3 times. I've had over 50, right around 50 ECTs. I have had extensive therapy. I've tried almost every medication that there are. I was always really open to trying different things, and I have been extremely blessed with exceptional doctors. All of them being going over and above.
When Maggie first came to see me, she walked in the door like many patients do. You wouldn't know they're depressed because they learn very well how to kind of cover it up. But within minutes, I was really taken back, and it takes a lot to really to jolt me because I've seen it all. But within minutes, she was so despondent, crying. A really existential cry about how exhausted she was of living. She had been through ECT and was about to go to another course of ECT because there was really nothing left, and the ECT had done some help, at least in the past, but it was limited until she heard about our treatments.
Literally, I had the sensation of this steel armor that I've worn my entire life, was chunks of it were falling off. I was free of it. It was gone. I woke up to not taking an antidepressant for the first time, and I can't remember when.
Almost 2 years now, I think it's been that we've been treating her, and she says that if nothing else happens, these are 2 years of great life that I wouldn't have had.
It was life-changing. I felt like I was blind, and now I see all of life in a different way. Dr. David Feifel has performed life-saving procedures on me, and I am forever grateful for that. I travel 1.5 hours, 2 hours to see him, and I do that because I trust him, and I really respect him. And his dedication and his hard work shows in every way. What I wanted my whole life was a peace of mind. I thought that would only come if I died. And how interesting I found peace here on earth.